We are living through times that require us to wear masks while in contact with others, whether at work or while commuting or socializing. This is to let you know that although you won't see us wearing masks in these animations, we strongly recommend the use of masks as part of COVID-19 prevention measures.
Hello, Farzana. How are you doing today? You look worried.
Ruxana, good to see you. You are right. I am worried. Near my house, there is a new COVID case. I was hoping as part of our healthcare staff, you could tell me more about COVID.
Don't worry, you've come to the right place. COVID is a virus, a kind of germ, which is invisible. These are tiny particles which can get you sick, even if you cannot see them. Germs can be passed directly from one person to another through direct contact or from touching things with germs on them. These germs could be on the floor, on production machines, tables, anything. But remember, they are not visible to the naked eye.
Okay, so if I take care not to touch, it's fine?
Not really. COVID can spread through the air as well. Their breathing, coughing, and sneezing sends germs into the air. Breathing these germs can also get you infected.
This is scary. How do I prevent it?
No need to panic. There are some simple steps. Step 1. Wash your hands for 20 seconds thoroughly. Wet hands and lather with soap. Rub hands. Scrub back of the hands, wrists, fingers and fingernails. Rinse hands. Dry hands by shaking or waving them in the air. Step 2. Cover your nose and mouth while sneezing or coughing with elbow or tissue. Throw tissue into the bin. Step 3. Avoid touching nose or mouth after touching surfaces without washing hands first. Mobile phones, toilets, kitchens, and any other object can be a risk. Step 4. Maintain distance of 3 feet from everyone. Friends, colleagues, even family members if possible. Step 5. Clean your clothes, footwear, and any other objects you touch frequently.
Easy to say, but how will I get Sohail and Afreen to follow this? Afreen, you need to cover your mouth when you cough.
It's okay. She's a child.
Sohail, this is serious. I just had a chat with Ruxana, our healthcare worker.
We are fine. It's just a flu. Hospitalized? Riaz is in the hospital. Afreen, you need to cover your mouth when you cough. What did the healthcare worker say?
She mentioned some important things for hygiene at home. In the house, we need to clean all surfaces with diluted bleach water or detergent soap or alcohol-based product. She shared important tips. Step 1. Wash your hands for 20 seconds thoroughly. Wash your food before you cook and keep cooking areas clean. All dishes and utensils to be washed with soap. Wash hands with soap. Wash clothes. Dispose of your used mask. Clean your mobile. Take a shower and wash your hands for 20 seconds with soap.
"3 feet away, remember?
all the time. At the queue, the elevator, lunch hour, while working. I hope your mask is new.
Yes.
Great. When you enter the workplace, clean your sandals or leave them outside and wash your hands for 20 seconds. Do not touch the faucet after you have cleaned hands and use your elbow to close the tap.
The safety rules are similar to the ones at home. So I should clean the food boxes properly after eating and also wash my hands after eating, right? If I touch doorknobs or any other surfaces, again wash, right?
You're learning fast. See? It's a few simple things we need to do. Yes, and before you leave the home, wash hands with soap for 20 seconds. Remember to always maintain social distance from others. In this section, we covered hygiene at work, hygiene at home, staying healthy and active.
Yes, Roxana. In addition to keeping my family safe from COVID, what are the general rules to keep me and my family healthy?
Let's play a small game to understand this.
It was good to hear what to do to stay healthy, but what do I do if I end up feeling sick? I want to know how to identify if I have COVID. I have heard all kinds of things.
Yes, there are a few key symptoms to watch out for. Dry and continuous cough, fever, where the chest or back feels hot, extreme tiredness, other flu-like symptoms, sore throat, body aches, runny nose.
Thanks, Roxana. It is all clear now. Hello, Roxana. I am a little worried.
Worried?
Sohail has a severe cold, and I think I am also getting one. I just wanted to check with you on COVID.
If you're seeing these symptoms, there is a chance you may have COVID. If you suspect you have COVID, Step 1. Isolate with family. Step 2. Inform your workplace to let them know you suspect you have COVID and seek leave from your manager. Step 3. Reach out to healthcare providers explaining your symptoms. Step 4. Get tested for coronavirus. It is important that you do not panic. Get in touch with a healthcare provider by phone. They'll be able to guide and let you know about steps and testing.
Thanks so much, Roxana. I will do so now. I will keep you updated. Hello, Roxana. Sohail, Afreen and I got tested for COVID. And thankfully, all of us tested negative.
Oh, that's such a relief. I hope you're feeling better.
Yes, all better. I wonder what we would have done if we did have COVID.
It takes a couple of weeks to recover usually, so it would have been important to follow the right medical advice. Getting better involves taking medicines as prescribed by doctor and taking rest.
I was really worried. If I had COVID, what would people in my locality say?
COVID is not your fault. It can happen to anyone.
You are right.
Remember, it is important to take care of general health just like you would in times without COVID. If you have any other health issues, like diabetes or heart trouble, don't neglect these and remember to consult a doctor.
Thanks for the reminder, Roxana. I have to say that all this worry and stress is so difficult.
Being positive is important. There are a few tips which can help you deal with this stress mentally and emotionally. You can talk to your friends and family through phone or by respecting social distance. Sleep for 8 hours to get some good rest. Exercise regularly. Avoid rumours on social media. Rely only on government sites or respected news channels for information. Build your confidence. Think about how you have overcome other illnesses, tragedies, and difficulties in your life. If you really need support, or you know of someone who needs it, you can always reach out for help. You can contact the government's Area Relief Fund representative, for example. Or, for any issue related to healthcare or safety, call one of the national hotlines.
It's great to know one is not alone in this. Thank you, Ruxana. All your advice means a lot. I'm going to share this with my peers and family, while of course always respecting social distance. Thank you for being so helpful.